Well, welcome back, everyone, for our afternoon plenary. In this final session of the day, we plan to share a great conversation which will explore how aged care providers are preparing for the reforms. Let me introduce you, if I may, to our panellists who, as you can see, of course, have joined us on the stage already. Facilitating the discussion this afternoon, Janet Anderson, who you know very well, of course, Aged Care Quality and Safety Commissioner. She will be looking after the discussion. Julia Lawrence, the Executive General Manager of Service Delivery at St Vincent's Care Services, is also with us. Justine Barwick, the Chief Executive Officer of the District Nurses, is joining us via Zoom, so we look forward to her participation. Richard Stiles, Manager of Governance, Risk and Quality at Kalyra Aged Care, is also with us, as is Katherine Platt, Head of Clinical and Service Governance at Bolton Clarke, and Wendy Hubbard, General Manager of Australian Regional and Remote Community Services Limited. So Janet is going to take over now to facilitate the discussion, and as I hand over to Janet, please make all of our panellists very welcome indeed. Thank you.
Thank you, Richard. Hello, everyone. Last session for the afternoon. We'll try and make it stimulating and engaging. Just to ensure that we have name recognition, let me cue you into the panellists in the order in which they're seated. We have Katherine, Julia, Richard, who probably is the self-evident one from a gender perspective, Wendy, and Justine, who's with us virtually. And I think you know me. All right. We have a fair bit to get through, and I wanted to offer a couple of remarks by way of preface to this session. As I was saying in my presentation this morning, we know a fair bit, but we don't know everything. We have the exposure draft. We certainly understand the strengthened quality standards. We have a fair understanding of the registration and re-registration process that you've heard about in the various parallel sessions today. And there are many other things we know too, but we don't know it all. And as I said this morning, that is not a good enough reason to watch closely and decide subsequently when you're going to start getting ready. The time is beyond now, as I'm sure you have concluded even coming into this conference this week. And what we're going to do this afternoon is explore how 5 providers have been working on preparing themselves for the new Aged Care Act and have been doing that for some time. Now, even as I say that, they don't hold themselves out, and you should not regard them as paragons of virtue in all of this. They know that they have further work to do, and indeed, as you can tell, in our discussions prior to today's session, they've been very straightforward with me about the things that they've scooted ahead on and the things that they're taking a bit more time about, the things they may not yet have fully commenced, and the things that they're uncertain about and with sufficient uncertainty to pause and await further clarification. So I think they have a lot to share with you, their insights about their journey so far. You may be at the very beginning of your journey. You may be somewhere in the middle. You may think that you've got most of it sorted. Wherever you are on that spectrum, I think there is scope for learning. There is scope for sharing, scope for insights, and the ways that it could be done or possibly should not be done to get the best result. And I do think this is a topic which is rich with opportunity to explore those highways and byways. So by way of starting, I'm going to ask each of the panellists to introduce themselves to you and to tell you where they're from and to give you a couple of sentences on where they're up to in their implementation journey. We'll start with you, Wendy.
Thank you, Jan. I'm sorry, I've got a very deep voice. I don't normally have that, but I'm feeling very... Okay, so I'm from the Northern Territory. I'm from Darwin. I look after Australian Regional and Remote Community Services, as has been outlined. We call it ARCS. and we have 11 residential aged care facilities that go from East Arnhem in Nullarbor right down through to the Central Desert and out to Docker River, which is 10 k's from the West Australian border. So right from the saltwater people, freshwater people, and down through to the desert people. And we also have so about 420 beds, but that's spread across all of those 11 sites. So they're all, well, some are quite small, and 80% of our residents are in fact First Nations people. And it's an extremely challenging situation to work in, because as a centralised, it's a regional office, say, we have to try and make sure we have consistency across all of those areas. So just in terms of the quality and safety journey, I think for all of us here, including ARCs, that we've come a long way in the last few years, in fact, but most interesting now to have the legislation and the quality standards changing, I guess, the way we look for evidence and demonstrate to the Commission that we're actually providing the services that we need to provide. So I'm looking forward to sharing some of that with the rest of you.
Hello, I'm Richard Stiles. I work for Kalyra as the Director of Governance, Risk and Quality. So Kalyra is a medium-sized South Australian provider. We primarily work around the Adelaide Hills and down onto the Fleurieu Peninsula. Quite an old organisation, we've been around for 130 years, not always in aged care, but more recently in aged care. So we provide residential care. We've got 3 residential homes, about 800 home care packages, 6 retirement villages, and we also do affordable housing, which is primarily focused at older Australians at risk of homelessness. Before coming to aged care, which was only 3 years ago, I'd spent the 14 years working on the other side in Commonwealth regulation, so I have a slightly different view of the world, and a lot of what Janice said today makes a lot of sense to me, and it's been very, very predictable. I think from Kalyra's perspective, we've tried to stay ahead, we've tried to keep up to date with everything that's coming out, and I think we have a good understanding of everything that's known at the moment. But also the reality that just because you don't know it, you can't foresee what will be coming. A lot of the things are straightforward that will flow on from what we already know. I think the key thing we've tried to do is do what we can and plan for what we can't, so that once we've recognised something, it's put into a formal plan. It doesn't disappear. We don't forget about it. We know we have to come back to it.
Hi everybody, my name is Julia. I'm from St Vincent's. So St Vincent's is an organisation that was founded by 5 very young sisters of charity that made a 4.5-month journey from Ireland to Australia back in 1838. So 186 years ago, they arrived on the shores of Parramatta. And today we're a unique not-for-profit social enterprise that has 2 really large public hospital health networks in Melbourne and in Sydney, 10 private hospitals, 29 aged care, residential aged care homes, 9 retirement villages, and a large virtual and home care service that's provided across Queensland, New South Wales and Victoria by a dedicated team of 30,000 employees of clinicians and support workers. And there's one governing body, the board of St Vincent's Health Australia. So, and what's interesting about the organisation is I thought that I was the one responsible for a small part of the organisation being aged care, but recently we had a look, and it's actually over 75% of the people in hospital are also older Australians that we're caring for. So we feel we're actually an enterprise caring for the older person. Our preparations started quite early, and I go from feeling really confident to really anxious. As Richard said, we have a good understanding of what we need to do, but the practical realities of operationalising that, bringing the team along and achieving what we need to achieve can be overwhelming at times. It's being led by an executive and a leadership team of about 45 people that come together at regular, what we call impact forums. We've really well thumbed through all of the resources, and they've been fantastic. We're incredibly grateful for those. And probably, there's a couple of things I could talk about our gap analysis and things like that, getting the right continuous improvement plan in place for our preparation. But the things that have been really important is actually getting our governing body across what we needed to do and making changes to our constitution and governance arrangements to allow for the legislative reform. We also got to participate in the test audit, and that was a huge eye-opener and gave us the opportunity to really refine what we were doing in relation to our preparations. And something a little bit different that we've been doing is we've been working on developing, launching and implementing a new care model that's really key. And I'm happy to talk some more about that later, but it's key to our ability to deliver on the standards and meet the legislative reforms. Thank you.
Hi everyone. Thank you for having me here. Can you hear me? That sounds better, thank you. My name's Katherine Platt. I am the Head of Clinical and Service Governance at Bolton Clarke. Some of you may know Bolton Clarke. We've gone through a big growth in the last couple of years. Originally we started 139 years ago as RDNS in Melbourne. And we merged probably 8 or 10 years ago with RSL Care Queensland. And then a couple of years ago, we've gone through further acquisitions, and we're currently at 88 residential aged care services, 38 villages, and we provide home and community support to more than 10,000 people every day. So we're pretty big. And we're across nearly all the country. We have a presence everywhere except for the Northern Territory and ACT, but we've got a presence everywhere else. We also do have an arm in New Zealand, and we also do have, we provide care to and some services to some people under the age of 65 through some other programs we run for homeless people. We have a pregnancy, birth, baby helpline. So there's a variety of services, just not aged care. We have undertaken ACHS accreditation in our Victorian home and community services for quite a number of years. And so I think that has kind of helped us prepare for these new standards because there are some similarities with that process. So just in terms of the audit methodology, having a provider level view and then do the evidence mapping against service level, and then having also the different, exceeding conformance, the different, rather than having met and not met. I think they're all really good things that we really welcome, because then you have the opportunity to demonstrate some of the really great stuff that you're doing. So much like the others on the panel, we do fluctuate between being, yes, we're really on this, we've got it all covered, to, oh, we've forgotten some other thing that we've got to run down a rabbit hole here and sort that out and sort this out. But we also started with a gap analysis like other people on the panel, and that has helped frame an action plan, look at some quick wins, some low-hanging fruit, and then we've worked from there. So happy to share on the session. Thank you.
Wonderful. Thank you, Katherine. Lots of hooks there that each of you has provided. Let's go to our fifth panellist, Justine.
Hello. Thanks, everybody. That was really good to be able to listen intently. And I feel a bit lucky, actually, because I feel like I'm just part of a conversation and I'm not distracted by everybody who's sitting in front of the other panellists. I'm Justine. I'm the CEO of the District Nurses. We're one of Tasmania's oldest community care organisations. And I actually thought that we might be the oldest on the panel today, but St Vincent's are older. We've been about in Tasmania since 1896, and certainly, you know, when we think about the change that the sector has seen since that time, it's just enormous. You know, our first care workers and nurses were out and about in Hobart on bicycles, and I reckon that the change started shortly after that. At the District Nurses, we've had a really, really big few years. We've been preparing for the supported home changes because we are a community provider. So we've been preparing for that and the, you know, associated different timeframes that have moved and shifted, which is absolutely fine. We've been preparing for a new Act and the new standards, and we've also been busy merging another provider into the District Nurses. So it's fair to say that we've had a bit on. In relation to preparing for the new standards and preparing for reform, we really look at this as it's just change management. It is preparing our staff because as leaders, it's not us who are going to embed these reforms into service delivery. That's our staff. They're the professionals. They are the people who live and breathe this. And it is a profession. They love their jobs. They love the outcomes that they're able to contribute to. And so it's for us to empower those staff to understand that this is just change and the impact that they have in the lives of the people that we assist. It just can't be said loud enough. Without this workforce and without bringing them along on the ride, you can't drive any change through. So we very much take the stance that we support our staff who work directly with clients to understand why there needs to be change, how it looks for them, what it means for the people that we support. We've done a lot of comms through our business and our service here in Tasmania. I won't go over everything that everybody else has said, but look, I think the challenge is before us to bring staff along on the ride. We will only see change, and that's a good thing. So yeah, that's certainly our flavour.
Wonderful. Thank you, Justine. Let me stay with you for my first question, and I'll ask each of the panellists to answer it in turn. Where did you start? Can you cast your mind back to when you first turned your mind to, gosh, there's reform and we need to get cracking? Where did you start?
We started talking to our staff immediately. We've got a good program of staff meetings at the District Nurses, and we use those as a conduit to get information into the business, but also to get information back out and concerns back out. So obviously the content is discussed in different ways depending on which work group it is, and we make sure that we capture information from those forums and that we use that information to guide us, to help settle our staff's the concerns of our staff about any matter, but particularly about the quality of care that we provide. That's really been the most important. And look, it's really old-fashioned as well, the open door policy and the management by walking around, but it really, really works. And it's a great way to test what you're doing, you know, engaging with staff in those casual hallway conversations as they come and go, before their shift, after their shift, whenever it might be. You can catch up about a load of things, and it's a great way not to pop quiz them, but to just, you know, see where they're at with their knowledge about reform. It's a great way to confirm that what we're doing is working.
Good on you, thank you. Let's come back to the panel. Katherine, where did you start?
Well, we started doing our clinical governance teams conducted a gap analysis because they're the ones, and clinical governance are the ones that, you know, are going to help support the organisation in the preparation of the pre-audit preparation tool and all the documentary evidence. So we've started there. Like Justine had, we're doing working groups people are allocated different tasks. But the other thing we did start pretty early on is we knew that because we're a big organisation, we've got a lot of head office support people that have actually never really been involved with an accreditation visit. They've never been involved, they've never had to be interviewed by an assessor. So we've started having sessions with the executive and senior management at a head office level about this is coming, this is what you will be expected to do. You'll need to start thinking about how you demonstrate and articulate to assessors how you do your workforce planning, how you do your information management strategy. And you have to think about not just how it's written, but you're going to have to talk to it. So some of those people have never done that before, so we have to provide them with that guidance and set them up for success.
Okay. This is a question without notice, which is why you never put me as panel lead. Complaints. The exposure draft talks about restorative pathways and so on. Has that been a discussion within your organisation yet, or is that a coming attraction? And by the way, it's absolutely fair if you say we haven't talked about it yet. I'm just interested because people's minds, and I'm sure it's the same in the audience, you go directly to assessment, on-site assessment, the visits by the quality assessors and so on. But there are other features of the Act, and I would have thought the planning would be encompassing, but some of this may not have received the same level of attention because there's more to learn or more to clarify, or you're not entirely sure what it would require of you, and that's something you're awaiting further advice on?
Are you meaning that the restorative, where you might be, there might be that financial?
Well, no, it's not so much about compensation, it's about putting it right for the complainant. So it's being more attentive to what a good outcome would look like from the point of view of the individual who's raised the concern. Now, your question alone is indicative to me that there's a lot more that needs to be done, needs to be communicated in order to introduce all of you to this new way of thinking. It is relatively familiar to the Commission, but we've not used that language, and I think we need to be far more explicit in unpacking those provisions within the draft legislation in order to assist you and everyone here to understand what it might look like and whether it might feel a bit different from the way that you as an organisation or any of your peers has engaged with complainants.
I would like to think that we're pretty lucky in I guess because of our scale, we are lucky that we do have quite a lot of complaint specialists in our clinical governance teams who are really, and a lot of them are ex-commission as well, including myself. So we bring, you bring another layer where you can go, well, hang on a minute, no, the end result is we got to resolve it, and it does help the process, and you can help support and guide services through what that looks like. You can have the systems and the frameworks in place that support that as well.
Good on you. Thank you for taking that. Julia, where did you start, and do you want to pick up where Katherine left off?
Yeah, I was going to do that if that was okay. Just the engagement with the person that we're serving. So some of the work that we started, as I said, was to develop a new care model. That actually came really sadly off the back of a sanction at one of our homes when I'd first started in the organisation, and having to stand in front of a room of residents and their families and actually apologise for having failed them, and then seek to remedy and recover and improve the care outcomes. There's nothing quite like having to stand face to face and meet with many, many families. And then what I learnt over that time, so I was relatively new to the organisation, and I was asked to go and, recover that home. And I spent so much time with the families and with the staff as well. And what I learnt was that people were very diligent. We had a board, we had a governance, we had clinical governance, processes, we had policies, but what was missing was that the staff weren't seeing the person in front of them. They'd see the empty plate, they'd finished their meal, they'd seen the glasses, but they didn't see that someone was sitting there lonely or upset. And they were very task orientated, and as a result we'd lost that relationship with the people and what really mattered to the people. We're caring for them, we weren't caring about them. And that's where we really started, was way back then, when we recognised what potentially was missing and what we needed to do to ensure that we did actually have a human rights, person-centred model of care that is based on relationships and partnering and providing care that way, as opposed to, and really shifted the focus from tasks and duty lists to the person and the relationship and engaging and partnering. And to do that model, we actually did so many consultations with people who were in our services, but also the families, people who weren't, general community. I got the opportunity to see lots of great models internationally, and we spent many years refining, and with the Royal Commission and also the legislative changes, we've refined that model and launched it on the 20th of February this year, which was International World Social Justice Day, all about human rights. So that was very deliberate. And for us, we want to serve the person, not the legislation. So we're focusing on rolling out a care model as opposed to responding to the reforms, and we're hoping that that's what's really at the heart of what we're all trying to achieve, and that we'll be successful in that way.
Let me stay with you. One more question. That sounds like a fairly substantial change program. Are you approaching it as if you were managing a very substantial change program?
Yeah, absolutely. We've got a 3-year implementation phase. We've got change management plan, communication strategies, training plans. We're changing every part of the business, so how someone views their invoice has to have the lens of our care model now.
Okay. I'm going to go to Richard next, but I do want to hear from Wendy and Justine as well, because smaller organisations without the benefits of your back office are probably sitting in the audience going, would that we had half that resource available to us, right? I can hear the whispers. So we need to hear the other side of the story as well, and there may be questions that some of you would have where you would, give your eye teeth to have a couple of extra staff who might assist you in doing this, but maybe that's not available to you. So what is your through line on this? What's your journey? But Richard, where did you start?
It doesn't feel like we've started. It doesn't feel like we've ever stopped. So I arrived, say, three years ago, and reform was well and truly underway. And it just feels as if it's been a continuous process ever since. We were quite fortunate in that we've gone through, all of our services have gone through accreditation in the last 12 months. So we have probably a good awareness amongst our staff around what's been happening, interaction with the Commission, changes that have already come in. They've been made very, very familiar with what's already happened. And I think part of this journey is understanding what you're actually changing, because a substantial part of it isn't changing. Some parts are, some parts are becoming much more clear about expectations, but what we do day to day, many of the things are not. So I think there isn't a start point, there isn't a stop. I don't think the Aged Care Act will be the final piece of reform that ever happens in the aged care industry, and I think it's that continuous improvement mentality that we all need to keep now, because I think change is becoming a word that's becoming redundant. It's just a way of life. So, yeah.
No, that's good. Thank you. I'll come back for more. Wendy.
So I have a couple of rules. In fact, I've got 5, but I won't tell you them all. The first one's don't go broke, which is a good rule to have. But another one that I try and work all through the services is do what's right. And so one of the ways that we work to do what's right is to... so what I did was brought in someone who's in the audience, Nicole Tate, an amazing clinical governance manager, and she's gathered around her some amazing people who are central. And I know you're talking about smaller organisations can't do that, but I think actually you can't afford not to. You need to be able to have some people with the expertise and the passion to be able to run a clinical governance process, no matter how small. So we've been working on a culture, I feel very kin to you, Julia, the cultural change process, which is about doing what's right for our people, whether it's our residents or our staff. But Nicole brought to me when the reforms first came through, and she said, I think we should go and do one of the pilots. I think we should volunteer to do a pilot. And I said, no. no, thanks. But indeed, we did do it with Murrujulu, which is one of our First Nations, our Nazi services, and we did it there because our service managers are right on top of the new legislation. Right, they're just right on it, and they're going, it'll never work. We won't be able to do it and all that. So it was really a great experience. I won't say it went well, but we came out with 97% or something. But the agony of it, of pulling together all of the information, of having the opportunity not just to be part of it, but actually to feed back in. And I think in a previous session we were just at, I think it was Michelle was talking about how she participated, their group participated in from Blue Cross and had the same experience, just the opportunity to actually, feed in and see how things have evolved because of our input, which is great. So that's how we started, and that's where we've got to where we are.
Why did the Murrujulu crowd think it was never going to work?
Oh, First Nations care in the desert. We've got 2-metre high fences with razor ribbon around them, and the gates are locked. And that's not to lock people in; it's to lock people out. And so that's because not everybody is bad in the desert, I can assure you, but there are people who will humbug and want to come in, and so we also have families. The First Nations culture, I'm speaking for First Nations people in the audience who know much better than me, but that family orientation works fine until you have an elder who has dementia, and most of the people in our facilities have a high level of dementia. And so it's just a different world, and that notion of assessment where you might have an assessor, you have the right to be assessed. It's like our people come to the gate and yell, and we let them in. It's a very different world,
Okay, that's useful. Justine, I'm going to circle back to you. You're one of the smaller organisations represented on the panel. What do you have to say to the bandwidth question? That, it's you, and then there may be a couple of others who support you in leading the organisation and keeping everything ship-shape. But how do you ensure that you're covering the basics, that you understand what you need to do, that you are embarking on and managing this change journey when there are relatively few of you to go around and you don't have a deep back office?
Yeah, look, that's a really good question. I think it's important to realise that there are a lot of providers who are out there facing the same, and possibly with less support than what we have on our team here at the District Nurses. I think it's about where you don't have the expertise, knowing that you don't have it. So understanding what skills you do have within your executive team or your management team. So it's knowing not only about capacity, but also capability as well, and what you have in-house and what you need then to purchase from a subject matter expert. I think our networking within the sector is really good. It is really important that we understand what services are out there, and I know we've got some amazing consultants that even our larger colleagues in larger businesses work with as well. So I think that's really important. Having a really dynamic, supportive and knowledgeable board is absolutely fantastic. Having people who understand not only aged care, but also business environments generally and requirements, those connections are really, really valuable. So I guess, the bottom line for me is, regardless of the size of our organisations, no one organisation can be everything. And I think, listening to my colleagues on the panel, there's a lot of partnering going on, which is really important.
So I'm going to stay with you. Top down or bottom up? Now, I know it's not a dichotomy and you wouldn't necessarily choose one over the other. You mentioned your board, and I do want to get a sense from the panel about the degree of involvement that you've had from the board, whether they're leaders or followers, and whether they're asking the tough questions or watching with some degree of interest. Justine, with you mentioned your board. What level of involvement have they had? Are they challenging you in the right way?
Absolutely. Yeah, absolutely. Our board at TDN, I always say they equal parts challenge me and support me, and I think that's the right balance. They're a great partner for me, and I for them. We have a charter that we've agreed on, and it's, the good old-fashioned stuff. It's, hard on the problem, easy on the person. We're really respectful of those individual skill sets that we bring, and we leave nothing unsaid as well. So I think that really gives us a great base from which to work. They work really hard at keeping up to date with within sector, within reforms. It is very much a partnership. I've got a very invested board. I've got a board who is not operational, however, but they are very invested, which is fantastic. And I think, honestly, in sector, that's what we need to have. We need to have directors who are invested, who understand the sector, and who really do care about what's happening in the field.
Okay, well answered. Wendy, board.
Yes, you mentioned, I think, this morning about trust. And I think the thing about the ARCS board is that we've worked really hard to make sure that they trust myself and the executive team. And we provide them with education as often as we can, and they are very keen that we, take the big leaps and put our face out there. So in terms of that, they want to know, of course, what's it going to mean to them. Like there's all the stuff around accountability and some of the penalties if we do the wrong thing, and they're pretty happy about that because they're sure we're not going to. But it's definitely supportive. I think leadership comes from the top, but I guess we are leading the board to some extent because it's very new, hard to get your head around.
And the investment of time required to get your head around it is something perhaps that they don't have, but they certainly expect you to.
Exactly right.
Yeah.
Yep.
Richard, board involvement?
Yeah, very, very engaged. Not just in the reforms, but they are generally engaged across other, what we class as probably business reforms. So things like large IT projects to be able to support us going into the future as we get more and more data requests to be able to automate. They're investing in that kind of thing, not just the reform. So it's a much broader picture. All of our board have done the Governing for Reform programme.
I didn't pay him to say that, by the way.
Yep. And we've also had a follow-up workshop with KPMG a couple of weeks ago to look at where we are with our reform journey and the board's understanding. I understand we had the report back last week, so that will be something we'll be starting to look at. But they are definitely well enough informed and curious to hold the exec to account. Having been on the receiving end of that, they are robust. But also, one of the points they often question is around the resourcing and the cumulative effect of reform. All the reforms taken individually, if you have enough time, effort and money, they're actually quite straightforward. If you don't have all of those things and then you add them all together, it becomes far more difficult. And our board have been very good at engaging around that cumulative effect and asking questions about resourcing.
That's interesting. Well, that's a very legitimate purpose for a board, and you would be surprised if they weren't engaged in those very sort of questions. Julie and Katherine, I'm assuming your answers are fairly similar, that both of your boards are very engaged with this change process. What expectations do they have, and I'll ask you in sequence, Julia first, what expectations does your board have of the executive in terms of engaging staff in the journey? A couple of you already mentioned that this is thing one in change management, that you've got to bring staff along with you. Is the board also aware of that as an imperative and that you're having those discussions with them, or is that more about what happens at the executive level?
Yeah, it's more what's happening at the executive level. There's a view that, we have a role to play and that we would be the key lead on bringing the staff along and actually managing the change. So they would be expecting us to take a lead on that. Something that is, you know, in addition just talking about the boards, we did have to make constitutional change and governance change to actually allow us, with all of our board subcommittees and, you know, the governing body needing to be responsible and how were they discharging their obligations, to allow for the consumer advisory body and the quality care advisory body. So how were they going to fit in? What does the report look like that needs to come from those bodies up to the board? How are the board responding directly to the consumer advisory body in particular, as well as the QCAB? So that's been an interesting new part for us. We've only had those in place, the CAB, since February, and our first meeting for QCAB was in April. So we're still working through that engagement with the board.
How did the first meeting go?
Well, it was interesting, Janet. They were longer than I anticipated. Everybody had a lot to say, which was great. We've got about 70% are representatives on the consumer advisory body, and the other 30% are actually residents themselves. Really articulate, really diverse backgrounds, a lot to offer. And now they're getting into the swing of it, because our first challenge was to get them to think at a macro level and not at a really micro level. Now they're doing that, and I've got to report back next time with how am I ensuring that I have the workforce of the future to provide the care that they need, as an example.
Excellent work. Wonderful. Katherine, the engagement with staff, is this something that you report into the board about, and what are you doing in that regard?
Yeah, they definitely have been asking about that, and we've got a communications plan. So for the RAC side of the business, as well as home and community support, we've got a variety of communication methods, and we've got a comms team as well to help with that, with the tone and the drafting of that information. I guess it's repetitive stuff. I think what staff really want to be reassured about, and certainly at a service manager level, is that they'll be provided with the right support at the time of a visit. That if when a visit is on when accreditation's going on, they'll be able to pick up the phone. They'll have the right support there. They'll know what to say. If there are some things that aren't completely done by the time the visit is, like by the time the 1st of July happens, then it's how you articulate how you're going to demonstrate something. So you might not have everything wrapped up in a bow in one particular procedure or a guideline or a policy, but we do it in a variety of different ways. So it's supporting your staff in how you articulate that and having the confidence to do that to an assessor. Yeah.
And is that an area of particular concern? What are we going to say? How are we going to demonstrate what we know and what we're doing? We're confident that we can demonstrate everything. What I'm not always confident about is a clinical manager or someone who is having a stressful day, got a lot of things happening in the home, and then they have to remove themselves and be asked really pointed questions by an assessment team. Which can be very stressful, and they can get themselves caught up. So what we want to be able to provide them with is, this is how Bolton Clarke can demonstrate this. And here's a paragraph that will support you in communicating that. Is the reform journey front and centre in the minds of staff routinely, or is it something that you periodically remind them about as you go about your planning at a whole of organisation level? Because it strikes me that an average member of staff turns up to work to deliver care and look after older people. They're not necessarily there to have the conversation around the reform enterprise. So I wonder how you knit those two together in a way which is meaningful for staff.
Well, for us, it's ongoing communication. It's the staff meetings. I think our service level managers are across it, but there's a real constant need to remind staff and engage with staff and remind them, hey, remember this is coming. Oh, when the new standards are in, we'll have to remember this. We'll have to remember that. But also engage them in some working parties and, involvement in how we are going to go on that change journey as well.
Richard, do you have an observation to make in that regard? How you judiciously keep it in people's minds without creating a big thing about it when in fact what they're trying to do is deliver quality care?
Yeah, I think for different levels of staff have different ways of viewing it. So certainly if you look to a care worker, they may not be interested in what's driving that change, whether it's the reform, a change in legislation, etc. They may be more interested in changing the model of care. They're more interested in how does that affect my shifts? How does that affect how I provide my care and the relationships? So I think it's really important to understand what is the message you're trying to send to each group, rather than send a message that there's reform and things are changing and this is how it impacts you. Because what's important to potentially our CEO is not as important to a care worker. Yeah. They have very different perspectives.
Wendy, you'd be much of the same view, I expect.
Yeah, I mean, it's important that everybody at all levels understands what do it right means, do what's right it means, and for, you're right, the care workers, it might be different to the service managers and how that's implemented. I did love the evidence mapping guideline, which is the right thing to say, Janet, I know. But I guess what we're really looking forward to is to see some evidence, and it came up again in the session we just attended in the home care one, around some examples which might be around the First Nations people and how those people how the evidence might look, because the assessors might see something completely different but it actually satisfies the criteria. So, but as long as people are doing what's right, then we should be able to have evidence there that shows that we're doing the right thing when the assessors come.
Okay. Moving the conversation to the people receiving care. The people for whom you exist, essentially, and the extent to which you feel they need to be drawn into the reform journey, or instead, or as well, be the beneficiaries of all that you're seeking to implement in lifting the quality and safety of care and putting the consumer even more to the forefront in terms of enabling them to exercise their rights of choice and so on. Justine, have you had any conversations with any of the people receiving services by the district nursing, or is that yet to come?
That's yet to come, Janet. We've certainly started having some early conversations, just maybe it might be a complaint resolution conversation where we're talking about what the future of aged care might look like. It's very early work. Obviously we're busy making sure with the consumer advisory and the QCAB that we've got those implemented, and I think that is part of the journey, but it is not the journey. I think we need to realise that our case managers have a really big role in talking to our care recipients when they're planning care, to understand the new standards and to engage with the care recipients in those ways. And I think we just need to really take our cue from the care recipients and engage with them, in ways that are meaningful to them. There will be care recipients who want to know everything. They want to know all about it. And there will be care recipients who just care about that last shift that they receive, because, as care providers, we are collectively only as good as the last shift that our service provider delivered. So I think we need to be really mindful. Obviously, we need to meet the requirements, as I said, but we've really got to be ourselves thinking like a care recipient too when we are considering our approach to change, our responses to complaints or concerns. So yeah, it's early work for us, but I still think it's meaningful.
And possibly a further elaboration of the rights basis of the bill, when we get to see the bill, would give you further amplitude, as it were. There'd be a better springboard for the conversation you might then seek to have with those receiving care from your staff. Do any of the rest of you have a view about the right time to start having a conversation with care recipients and whether you've embarked on that yet? Katherine?
I'm not sure when the right time is, but I was just reflecting that because of the implementation of the consumer advisory bodies and the opportunity to have feedback into the Act, we took a few key concepts and issues that we wondered what they thought, and we actually took them to one of our consumer advisory bodies, and we actually didn't get the response that we thought. So go figure, right? What do we know? Anyway, so I think we all have a really great opportunity to use those consumer advisory bodies in bringing them along the journey of the reforms, because those people that will put their hand up for those bodies will in general be the ones who are really engaged and they want to be informed, and they give amazing advice and feedback.
Yeah. Julia, do you have a perspective on this?
Yeah, so we've started, but not in a traditional way of, this is the reform, there's 146 actions and this is the, what we're doing, as I said, is rolling out our new model of care. And so we're talking to the consumers. They're a key part, equal to our staff in relation to our communication plan and training plan. So they've already had some training sessions whereby what we're informing them about is that what matters to us is what matters to you. The person-centred, human rights-based, trauma-informed, healing-aware, that's really been our focus. And so in that way, because the reform really is all about ensuring that we achieve that person-centred, human rights-based, safe care, that's reassuring them. And the sessions are actually collaborative, so we sometimes have residents, families and staff all in the one room, all hearing the same thing. So yeah, that's what we've been doing.
Okay. Just before I invite questions, and I have to go to the lectern to look at the iPad to do that, just one more comment from each of the panel members, and I'm interested in low-hanging fruit. If in your journey so far you've identified something which was a bit of a quick win, which was readily available to you, and which you could get across and get done, and which was a demonstration of momentum and commitment and direction, and it worked a treat, what would it be? And it may be no, you haven't found it yet. That's a legitimate answer too. But if any of you have any tips for the larger body of people listening, I think this would be one that they would be interested in hearing. Justine, coming back to you, anything?
Can I just have a think about that for a minute?
Yeah, sure.
It's a really good question. And certainly I love the concept of the low-hanging fruit. I think where you can get traction on a particular issue and get a resolution quickly, we should. Yeah, I'd like to have a think about that if that's okay, just while I listen to my colleagues on the panel.
Katherine, any ideas?
Well, some of the low-hanging fruit for us that we identified was taking some of our existing policy and procedure documents and just tweaking them with the language that, so we had all the right concepts there, but we just had to tweak the language so that it was consistent with the new standards. So, for example, putting in trauma-aware, culturally, I can't remember the terms now, but trauma-informed, culturally aware, yeah. So some of that language, which is just it's a bit different to what we had previously.
That's interesting. Are these live? Okay, I'll go here. That's really interesting. Language matters. It absolutely matters, and that's what you're also understanding. Julia, any low-hanging fruit?
It's interesting that you say that, because something that we thought could supercharge, and we haven't made the decision yet, but there are a number of consultants that have been working on aligning a whole suite of policies, protocols, guidelines, procedures to the new standards and the new requirements. And so we're considering, would it help us to actually purchase that suite and then put a St Vincent's and our care model lens and tailor them for us. The tip that I'd probably give everybody is that it's a whole of business. It tends to sit with service delivery, operations, clinical governance, compliance, but the people and culture teams, the finance, team, the corporate officers, I think that they go very diligently about doing what they do every day in perhaps processing, invoices or something like that, for example. And I think it's really important that the entire business, every leader has a role to play in rolling it out. So I would get everybody across what's happening, what your plan is, giving them some ownership, empowering them, inspiring them to make some change, to think differently. And all of our homes are very used to having a continuous improvement plan, but sometimes our corporate office isn't.
That is a really interesting insight, and I think that's gold. I think everyone having a part to play is the way you embrace the entire organisation in this joined-up enterprise. Richard, low-hanging fruit?
Yeah, I think one of the quick wins for us was using the pre-audit tool. That's allowed us to not just do the gap analysis, but it's now set us up for when provider registration happens. It's also allowed us to align our audit and assurance program around that. So what we're trying to do is use the reform changes to improve our business as usual operations. So you don't get necessarily a gain today, but you will gain as you go through. I think the other thing that we've just started is a formal collaboration. So in South Australia, there's a group of providers called the South Australia Innovation Hub. So we've now joined together as a governance team, and we'll be working through the reforms as a collective of providers so that we can share the things we've achieved, issues, problems. So we have a variety of different size providers. So for the smaller providers, that question of, I haven't got 50 staff, what do I do?
Yes.
We're hoping that will start to pull that around. We're probably in the middle group of that, and we have some larger providers. So we think that will be one of our wins, that with our working groups, we'll be able to accelerate those.
Well, there's definitely a keen interest in that, and we actually have a question along those lines for the smaller services. What can they do? And I'm actually interested in listening to the views of people in the audience about that too. I mean, somebody, Michelle has asked the question, but there must be some of you who have improvised, who have thought through the best approach to implementation, even though you don't have a very deep back office. And it may be that some of you want to share some of your experiences too. And if you do, not that I can see it, but if you want to line up in front of one of the mics, and I'll give you some airtime. But before we get there, Wendy?
I can't think of any low-hanging fruit. I was thinking as we went along, I was thinking perhaps it was this and perhaps it was that, but I think I was very grateful that some people had some.
No, that's interesting. Well, it's not essential. And sometimes, and I think specifically in relation to the services for which you have responsibility, the challenge is slightly more significant across their breadth.
It's different.
Yeah, absolutely. And your low-hanging fruit might look quite different, I think, from some of your colleagues in any event. Okay, let us go to some of the questions, some of which we have managed to answer on the way through. But I am genuinely interested if any of you is from a small provider where you don't have a large back office, but you are nonetheless making progress, cautiously, tentatively, but you are heading down the right track. Now, there is further work that we need to do to support you in that journey. And quite clearly, we've already identified some of the resources we've produced already, but there needs to be more. And we fully accept that. And we need to customise it to meet you where you are. So depending on your size, your location, your corporate structure, these are all things that we need to understand in order to tailor our resources to fit your needs. And we're designing interactive products which allow you to curate the suite of information which is most apposite to where you find yourself and where you're operating now. And I think that will be a bit of a jump cut in some of the ways in which we support you to be the best provider you possibly can be. And I'm not seeing anyone move to a mic to take up the offer I've just put into the audience, which means you've all got it sorted and you've got nothing to share. She said optimistically. All right. Change management, unknown funding. So Alison's asked, what planning have you completed to adapt to reform change in care management, unknown funding changes / model for HCP? Some of you do provide home care package services. There is uncertainty, and I suppose the question, maybe I'll interpret the question if I may, but there are things we still don't know. Has that prevented any of you, if you put in the negative? I mean, it sounds to me from what each of you has said that you haven't allowed that to stymie you, to paralyse you from action, but there are certain things that you can't prepare for. And Richard, perhaps I'll go to you. I think it was your line, know what you can do now and plan for what is not yet available to you. Do you want to elaborate on that a bit? Because I've got a feeling that is heading us towards an answer to this question.
Yeah, so we already know lots of things. The exposure bill may change. I suspect it won't change significantly. Most of the things in there, I think, at least the themes will follow through. So there's lots of things that we can do. And now's as good a time as any. My feeling with all regulation is don't worry about the regulation. If you do the right things at the correct time, the regulation will sort itself out. If you've done all the right things and the Commission come to visit you, you can have a conversation, explain it away. So I think in that respect, just concentrate on doing the right things when you can. There is always a tension between how far ahead of the curve you can get, and that's sometimes a resourcing finance issue. Sometimes people are just not ready for that conversation yet, and certainly some of the conversations with residents and families, I suspect those are too far ahead, because the question will be, so what does it mean to me? What's going to change for me? So I think there's always that balance, and it's around timing. But turning around and saying, I can't do anything, is a non-starter.
Yeah.
The other part with the continuous improvement is, once you've identified things, write them down, because they will disappear. There will be a million other things. And you can always say, okay, that doesn't need to happen anymore if things change, but at least you've recorded them and you know you've got to go back to them.
Okay, useful. I'm reliably informed we have a small provider at one of the standing mics. Speak now.
Guessing it's me. Hello, I'm Ben. I'm from Tangidra Aged and Community Services in Alice Springs. So we have a very small a group of employees. There's around 25, supported by a board that looks after 16 remote Alice Springs Town Camp communities. One of the areas one of the things that we have utilised from an Aboriginal perspective is the idea of yarning circles to obtain community buy-in of the new standards. That kind of happened at the announcement of the reform, and our biggest way to communicate isn't through paper. It has to be done verbally and through audiovisual means. So we kind of bring what we know as important ways to be able to get information across. And the Commission have provided some of the resources that we probably ordinarily wouldn't have used in the past, actually are using them now, which is really, really good. So there you go.
Thank you. Yeah, that deserves a round of applause. Well done, and thank you for standing up and sharing that with us. There are lots of interesting questions here. Let's see how many more we can get through. Laura's come through with one. There appears to be a huge focus on incident management and risk management system evidence. Would we be right to assume home-built systems would not suffice? The emphasis is on proper, robust management systems. No, not necessarily. What the Commission is most interested in is that you have an effective incident management system. So it is really up to you to demonstrate to us that it is fully capable of capturing incidents as and when they occur, that it can record sufficient information to allow two things to happen. First of all, to submit notification to us if it's within the reporting scope, but equally importantly, to allow you to learn from it, to analyse it, to put it into some sort of trend analysis and to reach conclusions about what needs to change in your service or services in order that it will not be repetitive, it will not occur again. So if you have a bespoke system which does all of that, well done you. But if your system is a bit jury-rigged and may have an Excel spreadsheet which relies on people's memories and doesn't have sufficient fields to give a proper account of something that went wrong, then it won't be fit for purpose and you'll need to do something different. So I hope that's given some reassurance, because there are numbers of bespoke systems out there. It doesn't have to be off-the-shelf product. If you've built something which works for you reliably and gives you insights which allows you to put into place preventative strategies to avoid recurrence, then you're doing what you need to do. All right, let's go to another question. Sorry, I beg your pardon. I'm struggling with...
Sorry, Janet. My name's Thomas.
Yes.
I'm from Manoa Homes. We're the smallest standalone provider in Perth metro area. So one of the advantages of being small is we can have that conversations with our residents and with our staff. So we've got it as a standing agenda item for both our board. Some of our board members have done the board training as well as myself, and we were pushing that through last year. But I've also started educating my incoming residents and families about the new standards and showing and talking them through as I sit down with their contracts negotiations, actually taking them through the information that's on the Commission's website. So they're fully informed, and then we're going to start taking our current residents through that. So that's what we're doing as a small provider.
And what an advertisement for small is good.
Yes.
Because you have those direct connections with the people to whom you're providing care, and you can have those conversations. There aren't too many layers in between you and them, and you feel that this is an appropriate discussion to have with them, to introduce them into some new expectations which will prevail as soon as the new Act comes into place. That's brilliant. Thank you. Yeah.
Hello, I'm Alison. I work with Aboriginal Aged Care in Port Lincoln. We're a very small organisation. Our board members are all Aboriginal people over the age of 60. When I started there 20 years ago, they were in their mid-60s. Now some of them are in their 80s. They love the service that they provide that's culturally appropriate to their people. They will do whatever they can. They have a lot of trust in me, which is pretty awesome in one way, but very exhausting in others, and I mean that in the kindest of ways. But they know there's a new reform. We have board meetings. I tell them about it. I tell them we just had a quality review in July last year. We passed all 8 standards. I had a nervous breakdown, but I'm recovered I've recovered. So Wendy, I'm admirable of what you do up in the lands, because working remotely and trying to, like my chairperson, he wasn't stolen generation, but his mother actually dug a hole and put bushes over him so that he wasn't taken from her. Another one of my board members is stolen generation. So there's a lot of cultural stuff there, and they love that they have a space that they can come to, and they will do whatever they can under the direction of myself and my co-worker to keep this program going so that they can deliver culturally safe, appropriate services. Thank you.
Thank you. I'm really interested to hear the value proposition for engaging with care recipients early. And I know that there's a degree of difficulty, particularly if there are multiple layers between the people with the ideas and the people receiving care. But what we've heard in the last few speakers is this matters. This is a conversation we can and should be having with care recipients as well. And I guess it's a case for each of you to decide the when and the how, but the why I think is fairly self-evident. And I think that's a really interesting insight that we've gleaned this afternoon as well. Wendy, Peter wants to know your 5 rules.
Okay, don't go broke.
You got that one?
Take responsibility. Do what's right. Oh, what's the other one? I forgot. But the last one is never give up. But make it better. Make it better. That's the other one. And never give up. So they're my 5 rules.
There's an alternative set of standards right there. Okay. This is an interesting question from Kirsty. How have the panel approached their reform preparation if they deliver both residential and home care services? A number of you are in that situation. Was there collaboration? If so, how was this conducted? Who wants to pick up the cudgels on that one? Anyone have a view? Or have you done it at a whole of organisation level and have been less concerned about its implementation in residential versus home care? I'm seeing Julia and Katherine both look interesting. Katherine?
It's actually not... how you demonstrate it will be different, obviously, but there's also a lot of common elements. So we have worked at a sort of organisation level at identifying what goes across all the, residential and home and community support. That's some of the low-hanging fruit sort of stuff that we can do at a high level. And then engaging in the different service streams then about things particular to home care or residential. And it's really going to be around how they articulate and demonstrate how they do things on the floor.
Yeah. Julia, any additional?
Yeah, very similar. And a goal for us is, because we have the acute hospitals, the virtual home care, retirement living and residential aged care, and we're big, we end up running the risk of being quite siloed. So you can think, I actually went to St Vincent's, I was a bit jealous because they had the whole continuum of care. And then when I got there, sometimes it's a bit big, so big that it's can be quite siloed. And so it's a really deliberate goal of ours to actually make sure that we have connected care, integrated services. So similar to Katherine, we did take a whole of organisation approach. We made sure that we had, when we put our hands up to be a test audit site, that we did both a residential aged care and a home care service. And wherever we can draw strength from the wider group we do, where we need to specialise, then that's what we do.
Okay. All right, David is taking us back to something we touched on earlier. And Justine, I want to bring you back into the conversation here. David's saying trauma-aware and healing-informed is a major new concept in the strengthened standards. How do the panellists plan to get resources and information to frontline care staff, often English as a second language and not clinically trained, so that they understand this concept? Now, let me preface whatever response you want to provide with an observation that we need to do some of the heavy lifting here too. We need to assist providers in unpacking these concepts and packaging them in a way that is meaningful to staff who may not have encountered this language before, but may be more familiar with the concept, the practice that sits behind it. Justine, do you have a view?
Yeah, look, I certainly do have a view, and I think it just goes back to we need to make sure, regardless of how our businesses grow and how our service provision extends, that we keep each individual at the centre of their care, and that our processes and our policies and those structures within which we provide for our staff to work really do respond to the needs of the individuals. And I think that really is the start of anything to respond to a need appropriately. Educating our staff all the time, even though our name is the district nurses, the bulk of our staff are non-clinical staff who are Certificate 3 qualified and who are working in the field with the clients. We also have a large nursing workforce as well. But it's about looking at the learning and development needs of each staff member or care team or cohort so that we can respond. And it's about listening to the individuals as well. Listening, not making any assumptions about what somebody's situation is. It's truly understanding and making sure that we resource our teams with training and that we're pretty fearless with getting that for them.
Okay, well done. That's a really good answer. Any other comments from the other panellists?
Yeah, I'd make one comment. The trauma aware is one of two, I think, significant changes and concepts. The human rights part, I think, is another. For many people, we've all heard the word human rights. We all think we know and understand it. But what that actually means for people in service, people who are providing services, what it means to organisations and the people who live with us, the people that we service, I don't know if everybody really understands it. And I think part of the bigger issue will be about balancing potentially 100 people who live in one building, everybody's human rights against everybody else's human rights, because we will all have different views and opinions, we'll all have different thoughts about things. So I think this and human rights are two concepts that we'll have to turn our minds to about how do we educate everybody and take them on a journey. And I don't think it's a 1st of July journey. I think it's starting to get those concepts, building in working practices, but I think this will take some time to actually embed itself.
Yeah, and I'm reflecting on your comments and also Justine's. I think the starting point is sound. The starting point is basically standard 1 in the existing quality standards. See and understand the individuals as they present to the world, as they would like to have themselves understood. And if you start from that position, then a rights-based framework, trauma-informed practice and so on becomes the flow-on of understanding the individual and what they need to live their best lives. I mean, there's clearly further expertise or knowledge that would enhance that practice. But if you start there, I think we've got the right springboard, right, in our existing standards. Okay, moving us on, and I'm keeping an eye, trying to keep an eye on the microphones as well, to see whether anyone's standing up and wants to ask a question in the room. There's one that we've touched on briefly, and I just want to take us back to it just transiently. In terms of, Sarah's asked the question about the amount of detail that you go into with staff. And we did talk about it, and I think the general sense from the panel was they probably don't need the complexity of the legislative provision, but they need more than the vibe. So there's somewhere in between those two where you have to draw them into an understanding of the provisions in the Act and what they translate to in terms of the delivery of care, but you don't need to take them through the legal taxonomy. Would that be a fair summary of where we landed on that previous discussion? I'm seeing heads nod. Wendy, with your particular challenges in the Northern Territory, is there anything that you are conscious of doing quite differently from what might be a more conventional approach to introducing this set of changes that you want to share with us as being bespoke to your particular circumstances?
I think it really is around respect for culture and First Nations people that is much deeper. And we were talking with that stuff about trauma-informed, where place-based cultural awareness is so huge. You know, people talk about the stolen generation, but it's not just the stolen generation, it's, lands. There's a whole bunch of things that as, well-meaning white people as well as our multicultural staff need to really deeply understand if they're going to understand and really make the centre of our universe these people who we're there to care for. So I just think it's probably deeper, but I don't know whether I don't know if that's tainted because that's probably the same no matter where you work. It's just, for us, it's First Nations, and for somewhere else it may be, Greek Orthodox or something else. But it is I think that deep cultural thing that we need to really get into.
And again, we find its home in the existing quality standards, but it's something that I think all of us are becoming increasingly aware of as being vital to the care experience. People can have safe, quality care, but not be enjoying themselves in the receipt of that care if it's not culturally secure, if it's not competent, and supporting that individual to live their best life in their cultural context. And I think, it behoves all of us to pay more attention to that, and also to see the way in which it's coming through in the strengthened standards and the way in which we can provide better evidence that that's exactly what your staff know they need to do and are getting about doing it. Any other questions? I'm wondering if we might move to closing comments before I hand back to Richard. And I want to hear from each of you. If there was a synthesis of your experience so far, and each of you is some way through your journey, none of you is saying we've got it sorted, what would be your takeout if, you have a lot of attentive ears here. What is the insight that you would seek to share that they may not have thought of, or that you would like to underscore, which you think would be helpful for people wherever they are in their journeys of getting ready? Katherine, we'll start with you.
Well, one thing I think that we haven't touched on is some of the challenges that providers might face with external vendors, and who, so external vendors, I'm talking about care systems, auditing systems, and we're often held to ransom by the system in how we articulate or demonstrate our compliance with the standards. Or there's a perception that we are held to ransom. You can do it in lots of different ways, but what we've done is had some early discussions with our external vendors. We still haven't got it sorted with them. It's an ongoing conversation. There's some challenges. There's certainly challenges around having a few months lead-in time to change a big system. There's a lot of technical issues, so we're having to think around how you manually do something so that you can prepare, you can articulate to an assessor for example, we're going to have a consistent approach across all our services on the collection of Aboriginal and Torres Strait Islander status. So we're going to have to actually do that pretty manually until the system catches up.
Thank you. I'm going to go out of timetable order. Justine, you're next.
Great, thanks, Janet. Look, I think change is inevitable, but growth is optional. And I don't mean to grow big, I mean to grow in quality and to grow as people. We can't do what we need to do at any point in a change journey if we are not bringing the staff along on the ride. So we do a lot of talking to our staff, and we can't say that enough. It's just so important. We talk a lot with our staff about how important it is and what a responsibility it is to be professionals in sector at this time. You know, I think we're going to look back in 8 or 10 years' time and the sector will be unrecognisable, and that's a good thing. So I think that responsibility is equal parts daunting and exciting. And so we use that sort of language to really contextualise to our staff at different parts of the organisation. So look, that's my wrap up. Let's grow as a sector, let's partner, and let's contribute to some great reform.
All right, Wendy, you're next.
I think we haven't really touched on workforce and the itinerant workforce, and just to make that point really at the last, that we have a lot of agency staff in the Territory, particularly in the remote areas, and trying to keep those people culturally aware, but also to understand what's going to happen when someone comes in to have a look at your work, why you've got to fill in 40,000 pieces of information when someone doesn't come home.
40,000.
Quite a lot. But I mean, I've got no issue with it because I'm in my ivory tower, but it is something for those workers who come through and they've come from Queensland or somewhere else, and there's a different system and there's a different process. So that's a constant challenge, I think, that will make it harder to get the reforms through.
Okay. Richard?
Yeah, I think from all the conversations, it's clear we're all going on the same journey, maybe from slightly different directions. I think the take for me would be we need both providers and the Commission need to trust each other and follow the journey. It's not going to work well for both of us at times, but we just need to keep going.
Thank you. Julia?
Yeah, I agree, keep going. We don't intend on pausing in any way, even if there is a pause in when the Act will be implemented. I think something I'm still grappling with, we've touched on this afternoon, is that I remember back 40 years ago, would you believe, to my first shift in a nursing home on the floor. And it was all about the 13 showers that I had to achieve by breakfast, with everybody sitting in a row that would be fed a spoon each as we went along. And so it's unrecognisable to me what we're doing today. I think it's a great thing. We really welcome the reforms. Like Justine, I hope it's unrecognisable again in less than 40 years. That's for sure. But I feel now like having a shower, having your clinical needs met, your medications, having a meal, a comfortable environment where you're safe is just a given. And I feel like where we're moving to now is a responsibility about people's lives and well-being in a whole nother way, you know, minimising boredom and loneliness. And, you know, so that's kind of a little bit overwhelming, I think, for me. So it'll be interesting to see how you know, I can't get 3 meals right in my house, let alone relieve boredom and loneliness. And, you know, so doing it for thousands of people that we're responsible for every day, I think will be really interesting. So I pretty much stand on the shoulders of the Sisters of Charity from our legacy. I told you briefly our founding story. I still engage with some of the sisters, not the ones that journeyed in 1838. And they are certainly a smaller group of people now. They're beautiful, inspiring women, and they say, be bold, be radical, be courageous, and extensively useful.
Oh, I like extensively useful. Yeah, that's worth a clap. All right, well, that brings us to the end of the session this afternoon, and please join me in thanking the panel. I think they've been champions. Well done. Thank you all. Really appreciate it. I hope you have gained some insights. Thank you also for your questions, which have been wonderful, and also for those who stood up behind a microphone and offered their wisdom into this meeting. We've gained a lot from the Commission. I hope you have as well. I look forward to continuing this sort of discussion into tomorrow's session, and then to report back to you and to a wider group on all that we've learned and all that we can seek to share and all that you might take away and share with the folk where you come from and possibly a wider group besides. Thank you, everyone, and I'll hand back to Richard.